During the pandemic, the need has been greater for our services. We've done a lot of work to provide enhanced services for our community. Open Door is vital to the communities and neighborhoods we serve. Open Door staff members listen and assess each patient and work together to provide integrated care.
I had a young patient, about 3 years old, who was coming with her mother because she's having some trouble with learning and some learning disabilities. Looking at her size and how she wasn't really engaging verbally, she wasn't really aside from trying to get mom's attention, she just didn't seem as if she was as advanced as she should be. So the family was concerned about developmental delay or autism. So I talked to them about that and educated about that. It could very well just be the iron, so I checked that first. And they were low. So I started her on iron supplements and helped her get her hemoglobin back up over the course of 6 months. And by 6 months later, she was eating, she was talking, she was engaging, much improved. There are many families that come in here who just can't afford a normal visit at other places in town or in general. And it's good to work here where we can offer that for our patients.
Due to the pandemic, the need for dental care is much higher. That's why Open Door is here to fill in that gap in our community. The children that we see at our school-based outreach program oftentimes have no dental home. If Open Door wasn't available, these kids would go without treatment. With your support, we will continue providing access to care to patients, if they have a dental home or not, and providing the best care available, regardless of their ability to pay.
The food distribution program was started because we recognized a need in our community, especially with the pandemic. We saw our patients and members of our community out of work, furloughed from work, losing insurance, closing businesses, out of school, and we sought to fill that gap. The response was so much gratitude. You could really tell that a lot of people were in need and really appreciated the food that we were distributing. Oftentimes, cars were lined up down the block hours before we even started. This food distribution really showed us the overwhelming need that we have throughout Mankato and the surrounding community. By supporting Open Door, you're not just supporting the things that are going on here day to day in the clinic. You're supporting all the things that we're able to do for the whole entire community, not just the patients that we see every day.
We have this patient who was prescribed opioids for pain after he had an injury, and like many people, he struggled to discontinue them. After his doctor stopped prescribing the medications, he then made multiple visits to the emergency room seeking opioids, and eventually they stopped prescribing them as well. And to offset his symptoms, he started using street drugs like methamphetamines. The cycling of pain and cravings were so intense that he was seriously considering suicide. The family became very concerned and encouraged him to be admitted for inpatient treatment. After his successful completion of inpatient treatment is when he became an Open Door patient. The treatment consists of medications, assistance, therapy, and of course it includes guidance and support.
Open Door Health Center makes a difference in our community every day. During the pandemic, we have taken care of individuals and families who have lost businesses, they have lost jobs, they have even lost loved ones. Open Door is here to provide the care they need, regardless of a patient's ability to pay. As things have changed in the past 2 years, Open Door has responded with innovation and strengths. Like everyone, our team is tired and understaffed. Yet we know our work is important. The way to get through a pandemic is together. Please support us as we bring health and prosperity back to the community, because everyone
Because everyone
Everyone
Everyone deserves an Open Door.